Okay, everyone, we're going to go ahead and get started. Thanks so much for joining us tonight. This is our webinar on, is it ADHD? Is it autism? Is it anxiety? I am Mandy White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, where we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, all psychological concerns. You can see our clinicians at the bottom there across the screen. It's me, Natasha Brown, Jill DePietro, Sam Janete, Deidre Edwards, Nav Gill, and Maddie Lawler. And Natasha is here with me tonight, and we'll be leading this webinar. We all have experience working with people across the lifespan, but we also have special training and experience to work with children and parents in particular, including assessment and parent work for babies. This is our 7th and final webinar in our monthly series. Recordings for our previous talks are on our website. It's at smallbrooklyn.com/services/talks. Some of you have been with us for every webinar, which is awesome. Thank you so much for joining us each time. Feel free to pass on any of these recordings to anybody who might be interested. It will remain free at that website, but also on our YouTube channel. You can search for Small Brooklyn Psychology. All of a sudden I have a social media presence that I really didn't necessarily want, but these are our times. This series is media sponsored by Park Slope Parents, which is our amazing resource in Brooklyn, New York, and beyond. If you haven't checked out Park Slope Parents, please do. I'm sure many of you have heard of it. Many of you are members, but they are really instrumental in providing a ton of support and connection in the community, and have been very personally helpful for me as well. So thank you to Park Slope Parents. We're also sponsored by Premier Pediatrics, which has locations in Brooklyn and Manhattan and the Rockaways. They are an excellent pediatrics practice and have been giving extra support to new parents through a program called The First Month. So during this talk, if you have questions, please type them to me in the Q&A box. As Natasha speaks, I'm going to be monitoring the questions, and then we will get to a Q&A session at the end of the talk. So definitely feel free to stick around for that. And so without further ado, I'm going to introduce Natasha, who has a PhD and a CAS, which is a Certified Addiction Specialty certificate. She has multiple years of experience in conducting neuropsychological, psychological, and educational evaluations across the lifespan from young children to older adults. She did her undergraduate at Cornell University, with me in fact, her PhD at the University of Albany, and her postdoctoral clinical neuropsych training at Fielding Graduate University under Dr. Elkanan Goldberg. She has worked in a variety of settings, including medical centers, both inpatient and outpatient, university counseling centers, community mental health facilities, New York City schools, private children's camps, and private practice. Prior to working with us at Small Brooklyn Psychology, Dr. Brown was a senior psychologist for over 6 years at NYU Langone Orthopedic Hospital within Rusk Institute of Rehab Medicine. And we are so lucky that she joined us last year, and we've been just so grateful to have her. So she is going to be leading this final webinar, and I hope you enjoy it. And take it away, Natasha.
Thank you so much, Mandy. It was a pleasure. It's so nice to, I'm not able to see anyone, but I'm so happy to have you join us today. It's definitely a pleasure. And I'll be answering a lot of the questions that were sent to us in advance throughout the presentation, but also questions at the end. So, and the presentation today is it ADHD, autism, or anxiety? And, you know, one thing I will say, we've all experienced any level of symptomatology from any of those 3 diagnoses. You know, we've all felt worry, we've all felt anxiety, and sometimes more anxiety than the situation may have predicted. We've all felt socially awkward. We've all not known the right things to say, whether it's in a new social environment or even amongst our friends and our families who we've known for years. Sometimes you just don't know the right things to say and you feel really awkward and uncomfortable. And we've all had signs of ADHD where, you know, you have to do your work for the day and you just can't concentrate no matter how hard you try and no matter what deadline is in front of you. And I know for myself, just, you know, just losing items, losing keys or any number of things, sometimes that can be a sign of ADHD, but that's also so very normal. And that's always the big question: what's normal and what isn't? And a lot of these, like I was just saying, a lot of these behaviors that we're going to talk about today can be very normal or neurotypical. But when people come to us, the big question is there really more to what I'm seeing here? Why am I or my child avoiding work or school, not socializing like other kids, feeling like they have to put on a mask in public, feeling disorganized, not being able to finish one's work? So, like I was saying, there's a huge degree of normality to any number of the diagnoses that one can be diagnosed with. But at the same time, sometimes the presentation is a little bit more or a lot more than one would expect. And that's where we would come in. A lot of times, especially based on this presentation, the big question is what's happening with my child? It could be anxiety, it could be ADHD, it could be autism, and honestly, it could be a combination of two or three of those diagnoses. You know, as of 2013, individuals who were diagnosed with autism were also finally allowed to be diagnosed with ADHD because the DSM, which is kind of like the psychology Bible, um, came up to speed with what a lot of clinicians were seeing, which is even though there were social communication difficulties that a lot of individuals with autism had, they also had a lot of difficulty with concentration and may even have shown symptoms of a lot of fidgetiness and hyperactivity. So just because you're diagnosed with one doesn't mean you'll be only diagnosed with one of those. There could be a combination of factors that are leading to the presentation that you're seeing, your other family members are seeing, or teachers are seeing. And it may not even be one of those three, but obviously that's the topic of the day. But it could be a learning disability that's challenging someone in school and at home, or it could be depression. There are so many diagnoses that can explain the significant level of difficulty someone is experiencing on a fairly regular and more than likely a daily basis and throughout the day. So, why did we choose to do a topic about autism, anxiety, and ADHD? I call them the three A's. And the reality is because they overlap so much. It's just based on the terms, they sound so different. ADHD, okay, attention and hyperactivity, but it's so much more than that. Autism, social awkwardness, repetitive behaviors, anxiety, clear symptoms of worry. But those three diagnoses have a lot of genetic factors and similarities. We know that there's a genetic component to this presentation being expressed in an individual. If you have a parent or an older sibling that has any one of these three diagnoses, you're more likely to be diagnosed with not just the same diagnosis, but you also could be diagnosed with a different type of diagnosis. So if you have an older sibling that's been diagnosed with autism, the younger sibling may be diagnosed with autism, but may also be diagnosed with ADHD. So there's definitely a lot of times, not all the time, but a genetic factor to why you see anxiety, ADHD, and autism presenting. But there are also hidden disabilities. And it's not overt, it's not like a broken leg, but they come out in different ways. Someone who has difficulty with concentration may have ADHD, but it may be difficulty with concentration because they're so worried about a test coming up or feeling embarrassed in front of their family members that they just can't concentrate. So it's a hidden disability that can have any number of reasons behind it. They also co-occur frequently, which I just discussed. Someone with ADHD can be diagnosed with autism and vice versa. And they also occur across the lifespan in different environments. You know, when I think about the difference between a label versus a diagnosis, a label you can kind of put on and take off. But the reality is with a diagnosis, it's not something that's just meant to be present for the year that you get it or for the next couple of years. For the overwhelming majority of individuals, if you're diagnosed with something in your as a toddler, as a preteen, you're more than likely going to experience some level of symptomatology throughout your life. But with proper treatment, those symptoms can definitely be diminished over time. And they also, with the 3 A's, like I was calling them, they exist across different environments. If someone has autism, it's not just going to be displayed when they're around other kids, but they're also going to be presentations that show themselves within the home with their families, people who know them the best. So all of these, it exists across, for these three, exists across the lifespan in different environments. They're also often misunderstood, partially because the differences can be very slight. If you're just going for surface level presentation, it's easy to have a misdiagnosis. Many individuals who eventually are diagnosed with autism, were actually diagnosed with ADHD 2 to 3 years earlier. And therefore, there was a delay in being diagnosed properly, but also a delay in getting services. So there's obviously overlap between ADHD and autism in terms of their presentation, but those differences can be slight and can be overlooked if there's not a thorough investigation and evaluation that occurs to really investigate what's happening and why. So firstly, we're going to talk about anxiety. What is it? And honestly, it's the best way to describe it is it's an evolutionary alarm system. It's something that came about within the human race to prevent us from being harmed in social situations or within our environment. But the reality is now we don't have that. We're not having anxiety because we're fearing being attacked or killed in the wild, but because we feel vulnerable. We're afraid of being embarrassed, feeling unprepared for changes, or a fear of being in trouble. These are usually the reasons why anxiety displays itself in everyday life for people at this time. And with anxiety, there are usually three categories of symptoms: physical, cognitive, and physiological. The physical symptoms are some of the things that we see in comedies being made fun of, like a faster heartbeat, shortness of breath, sweating, stomach aches, nausea, feeling restless or on edge. But it also can be diarrhea, dizziness, hot flashes, tingling or sensations, shaking even, but also sleep difficulties. A lot of individuals with anxiety have difficulty falling asleep, and when they wake up, they feel just as anxious as they did right before they went to bed. So as a result, they're tired throughout the day because they didn't have a restful sleep. So anxiety can, like I was just saying, it can have physical symptoms, but it's also cognitive symptoms. And those cognitive symptoms usually come before the physical ones, but sometimes people are not aware of them. And they include feeling worried, ruminating, or repetitive thoughts about the same thing, whether it's performance anxiety or fear of something or concerns about being embarrassed, negative self-talk. And some examples of those would include people are laughing at me. Why is my body doing this? Or I feel embarrassed. I won't be able to escape if I go to that party. I need a guarantee that we can leave at a certain time if I want, or there will only be a certain number of people within the family gathering. There are a number of cognitive factors or thoughts that contribute to the physical symptoms or presentation of anxiety. But there's also a physiological presentation. Individuals with anxiety are very much known to have difficulties with concentration. And as a result of that, if you can't concentrate on something, you're not going to remember what someone told you to do because you basically never heard it in the first place. But also physiologically, individuals who have anxiety will have a lot of difficulty being able to initiate or start an activity, whether it's homework or schoolwork. They also have a hard time staying on task. And they're more than more than most likely to leave their work incomplete, and need to be reminded or pushed or forced to get back to their work and finally complete it. So they also can seem a little bit disorganized, compared to others. But what does that sound like to you? When I talk about concentration difficulties and memory difficulties, as well as executive functioning difficulties, like difficulties starting a task, staying on task, organizing oneself, that sounds very much like ADHD. And that's just one of those examples of why anxiety and ADHD can coexist, but also you can be diagnosed with one, and it be an inaccurate diagnosis because someone's not looking at what's underneath the difficulty with concentration. If you go to your doctor and say, I have difficulty concentrating, that might be the end of the conversation and you're given a stimulant, as opposed to saying, well, why do you have difficulty concentrating? What's contributing to that? When does this happen? How often does this happen? And that can lead to a very different diagnosis, depending on who you're working with. The other aspect of it is, what is ADHD? And as most of you know, ADHD is defined by attention deficit hyperactivity disorder. There are three different types of ADHD: inattentive type, hyperactive type, and combined. And ADHD, when you think about ADHD, most people think about the combination of the inattention and the hyperactivity, but you do have a subset of individuals that are more in the inattentive portion. And that honestly tends to be girls statistically. For those who are diagnosed with inattentive ADHD, they tend to be diagnosed a couple of years later, usually in as tweens or teenagers, because they're not being hyperactive. So there's not a clear-cut reason to have them diagnosed, but they're kind of like that daydreamer. They may not, people may also often complain that, they just can't pull themselves together, or I know they're capable of better work than they're showing me. And that's because it's hard for them to concentrate and pay attention and give their best effort. So that's an example of the inattentive type of ADHD. The hyperactive type is what you would expect: difficulty sitting in one's chair, being fidgety, moving around the room, jumping on chairs, things like that. And the combined type is obvious, a combination of those two. And as I was noting, the most common symptoms of ADHD include challenges with attention, concentration, sitting still, and being impulsive. And someone asked in advance, what's the difference between ADHD in children and ADHD in adults? And the reality is the symptoms overlap quite a bit, but with adults, that hyperactivity shifts usually to someone being more restless. And that restlessness can come out and that restlessness as well as that impulsivity can come out in very different ways. They may have a hard time sitting in traffic or waiting in line. They may be quick to becoming angry because it's hard for them to control those impulses. In relationships or when raising a family, they may be disorganized to the point where they're not paying the bills on time, they're not picking up the kids on time, they're not making dinner when they say they're going to make dinner. And as a partner, the partner may say, well, they never listen to me, and personalize it. But the reality is it's ADHD making it hard for them to concentrate on any given moment. And then where that comes out sometimes is sometimes with self-harming behaviors, but also substance use. And sometimes alcohol or other substances can be used to treat ADHD in adults. So I just kind of wanted to present that. And as it relates to girls versus boys, you tend to see more girls being in the inattentive category as opposed to the hyperactive category. But you can still see a lot of fidgetiness, and it's a lot of girls are still diagnosed with the combined type for ADHD. Additional symptoms of ADHD, some of which I already mentioned, are daydreaming, but also forgetfulness, being easily distracted by anything in the room, trouble following directions, having a lot of tantrums, trouble organizing and completing tasks, trouble staying on tasks unless it's something that they really find enjoyable. For a lot of the kids we work with, we frequently hear parents say, gosh, it's so hard for them to get them to concentrate on anything and to stay focused and do their schoolwork. And they're so smart, but they just won't sit and do it. And it ends up taking them so much longer. But if you put in front of them something that they really like arts and crafts, or if they're a reader, having a book in front of them, they can do that for hours on end. And so even though someone has ADHD, it doesn't mean that they never can focus. It just means more times than not, it's hard for them to focus unless it's something that they really, truly enjoy and get a lot of pleasure in. Aside from that, they may act without thinking. So that goes with impulse control and impulsivity. They may seem like they're on the go and kind of moving around and jetting around even within the same room. They may have trouble with turn taking. So they may impulsively say what they're thinking and feeling, and not be attentive enough to listen to what you or their friends are saying. They may blurt out things or interrupt. And they may not always pick up on obvious cues, like social cues, like friends looking bored or annoyed, because they have trouble focusing on any one thing, that they miss those important social cues, which can sometimes look like autism, but in reality, for some people, it's ADHD only. They also may be overreactive to sensory input, like sound and taste. They may play roughly because they're just not picking up on social cues, and they may take physical risks because they're just being impulsive. They may cross the street without looking both ways because they're focusing on what's on the other side of the crosswalk, as opposed to focusing on what's really important, which is what direction the cars are going in. So could ADHD look like anxiety or autism? Yes, absolutely. There is always a social and emotional impact of ADHD. There's a reluctance to start a task because it's just so hard to focus. Can you imagine, it being so hard to focus that someone wants to sit you in front of at a desk and do something that you find so boring? It's going to be hard to convince them or get them to sit down and start what they don't want to do. They also will have trouble following social rules because they have so much energy. There may be a lot of fidgetiness or hyperactivity that prevents them from listening to what their peers have to say, sitting down for the entire class lecture. They may also avoid other people, in part because people are upset by the fact that they have so much energy. It takes energy to focus on them. So they may avoid others because they get so much negative feedback from, whether it be classmates or kids on the playground or parents or teachers. And they also may have trouble making and keeping friends. A lot of kids that we've worked with ADHD will say, I think sometimes my friends are annoyed by me. And it's because they're not doing a lot of turn taking in conversation. And so even though they may have trouble making and keeping friends, it's not because they don't have the social capabilities, but they don't have the focus to pick up on those that social information and communication that their friends are trying to share with them. And could ADHD look like anxiety or autism? Yes. It needs, for individuals, they need to be disciplined frequently, and this can lead to them having a lower self-esteem, which can lead to anxiety in social situations. They may have less motivation. They also may feel overwhelmed and discouraged and frustrated, as well as having anger, sadness, and anxiety. So even though the topic of the day is ADHD, anxiety, and autism, individuals with ADHD may be diagnosed with anxiety, but they also may have depression, or anger issues or emotional dysregulation, that comes out through difficulty controlling their anger. So it's always important to really look between the lines and say, okay, it's not the surface qualities that we want to look at, but what's really behind it, and if what's underlying it, is there an outcome to that? Is there a social or an emotional impact that's also coexisting? And thirdly, what is autism spectrum disorder, or ASD? And as many of you know, autism, you really have to classify it within two categories: difficulties with social understanding and communication, as well as repetitive or restrictive behaviors. So that social communication and understanding falls into the category of poor social skills. Even though they may understand, yes, I'm supposed to say hello and goodbye, they may not intuitively understand what social norms are. So they may shy away from friends when they start crying, or seem less empathic than their peers or other family members because they intuitively don't understand what they're supposed to be saying, in part because they may not be picking up on body language and facial expressions, but they also have a harder time understanding the emotions, putting themselves in the place of someone else and understanding the other person's emotions through that person's perspective. And as far as the second part of autism, which is repetitive and rigid behaviors, they may be so rigid that they only want to do things their way. And a lot of parents who come in with their children who may eventually be diagnosed with autism, they often complain about the rigidness. That if you want them to stop playing and go outside or go to a movie with the family, it's everything breaks, it just becomes a full tantrum and outburst. And it's so hard to get them to make any changes to what they're doing, as well as changes to their routine. If they're supposed to go to swim class one day and the bus breaks down, they may have a full outburst, even though it's something that's outside of anyone's control. They have a hard time understanding why there's a change. And because they're so rigid, any change in that expectation or that plan for the day makes them feel out of control. Aside from that, in this category, you also have sensory sensitivities. That could be sensitivity to light, either wanting things really bright or wanting things to be really dim. They may be very picky eaters because they have a lot of texture sensitivities. They may have touch sensitivities. They may not want to use certain toothpaste, or not want to use shampoo or soap when they take a shower because they don't like the way it feels, because they're so sensitive to different sensory inputs. They may also display sensory seeking behaviors like licking things frequently or touching different things around the house and textures like velvet. They may just be seeking out any type of sensory information, and exploring their environment through their senses. And also it could be obsessive interests. Individuals with autism have very specific interests. And those interests can be, I want to say roadblocks, but everybody's child loves roadblocks. But what makes it a good example is the fact that they may be overly invested in Roblox, or they may be overly invested in gymnastics or soccer. They just have very obsessive interests, and those interests don't have to be sustained for year after year. They can change every couple of months, but they become really obsessive. And even if you're trying to talk to them about something else, they may pull the topic back to that specific thing that they like, whether it's soccer or gymnastics or any number of things, or Roblox. Um, but there are other signs of autism that may also come through, like avoiding eye contact. And one thing I will say, I know that's pretty much what the first thing that people look for as it relates to autism, but individuals with autism may have really good eye contact, especially girls. Even girls who have autism are more likely to have better eye contact than boys who have autism. But they also other signs may be that they avoid physical contact because of those sensory sensitivities. I've had a lot of parents say, my child never likes to hug. And when they hug me, it's really awkward and rare. They may also have, as a toddler, someone else asked, how old can you test someone? We at Small Brooklyn, we test from 18 months and beyond. So for kids that are 18 months old or 2 years old, they may have delayed speech or no speech. And sometimes that's a symptom of autism. They may repeat phrases over and over again, whether or not it's when they're learning language. So as a toddler, but also sometimes with like 6-year-olds and 10-year-olds. Sometimes someone, a repetitive phrase or statement that a child would say was everything was boring, but sometimes the word boring didn't really apply to the situation. But that was a repetitive statement that or phrase that they would use over and over again. And sometimes kids and adults may have overreactions to smell and taste and sound and touch and trouble recognizing safety and danger. And as you'll recall, we just mentioned trouble recognizing safety and danger, but with ADHD. But in those cases, it's because they're so impulsive, they're paying attention to what's across the street as opposed to what's happening in the crosswalk. So those are some other possible signs of autism, but also struggles in groups. Struggles in groups can occur with anxiety too. But with autism, it's the difficulty of being able to pick up on those social cues that makes groups really challenging for individuals with autism. They may avoid other kids, but also, especially with children, they may avoid other kids, but they may be better with adults or younger children because there's less of a need to pick up on social cues and the social norms aren't as nuanced. If you have a child that's really good at verbal expression, adults will love them. And if they're around younger children, they can play with them, but they're not expected to be as socially adept as they would if they were playing with a kid their own age. They also have a hard time making friends and keeping friends, as well as romantic partners. A lot of kids with autism won't initiate contact through text or through phone calls. It just doesn't occur to them how to keep a friend, how to maintain a relationship. They may say awkward things, which can be any number of things, and they may also be fidgety. So those are also signs. And when you think of fidgetiness, what do you think of? ADHD, the hyperactive component to it. So that's why with the question, could autism look like anxiety or ADHD? Absolutely. The social and emotional impact of autism is the fact that if you're pushed to be in social situations or you're so rigid and your routine changes, you may have a very overwhelming tantrum. And sometimes those tantrums can be regularly happening. You may be isolated, just like individuals who have anxiety because you're avoiding social situations. A lot of times there's a misconception that individuals with autism don't want to be around people. But the reality is a lot of individuals who have autism also feel a sense of loneliness because they do crave and want those interpersonal connections and friendships, but they have no idea how to go about doing that. They also have worries about being in social situations because they've been criticized and have had so many missteps that kids have made fun of them that they may worry about going into a new social situation. They may be shy or feel embarrassed or have a lot of frustration, but they also may have difficulty communicating their feelings, understanding others' feelings and perspectives, or be upset when, like I was saying, routines change. And they may just move their body around and seem fidgety, but in reality, they're doing it to self-soothe as opposed to impulse control issues. So the big question and the initial question was, is it anxiety? Is it ADHD? Is it autism? So it's important to think about how those things can overlap at home or look the same at home and in school. Individuals with either of those symptoms or a combination, or either of those diagnoses or a combination of those diagnoses may have difficulty concentrating. They may not respond to their name when they're being called. So with autism, that's especially with younger kids, they're not responding to their name because they're not as interested in social interactions. But with ADHD, they may just be focused on something else, as well as with anxiety, focusing on something else internally, whereas with ADHD, they're focused on something externally. At home and in school, they may feel lost or confused because there's so much information that they have a hard time weeding through what's relevant, but also focusing on what's relevant. They may not learn at the same pace as others. If you have anxiety, it's hard hard, and especially performance anxiety, it's really hard to focus on the lesson at hand if you're worried that your teacher might call on you to respond and you're afraid of being embarrassed. If you have ADHD, you're focusing on so many different things within the room that you're not focusing on the lesson at hand. So that's an example of at home and in school, what you may see. You may also see an individual who has difficulty following directions, starting projects, finishing things independently, adjusting to changes in their routine, or being fidgety. Socially, individuals that have anxiety or ADHD or autism may present with a lot of social challenges that are kind of the fruit of those diagnoses. So they may struggle in groups, they may avoid other kids, but are okay with adults and younger kids, like we just discussed. They may play alone a lot. Or they may not even seem interested in other kids, but remember, the reason for it can be very different, or is very different based on the diagnosis. They may also have a hard time making and keeping friends. We'll say awkward things. With autism, it's because of this, they're not picking up on social cues and intuitively don't understand social norms. They'll say something that's awkward, but also for someone who has ADHD, they're not in the moment. They're focusing on so many different things. They just may say something that's not related, and therefore comes out as something awkward. They're not good at taking turns in conversation. They may misread social cues, or misinterpret playfulness, or become bullied or be bullied. So ADHD and or autism can lead to anxiety. And as I noted earlier, you may be evaluated, but you may not just have ADHD, you may also have ADHD and anxiety. And a lot of times having autism and that social awkwardness, the difficulty of social interactions, as well as with ADHD, the difficulty in focusing, and therefore the offshoot of that is difficulty in school and at home, can lead to a lot of anxiety. There may be fear or panic in uncomfortable situations. There may be difficulty adjusting to new environments, especially ones that have a lot of structure. And phobias can develop as a result of those ADHD or autism. So it's really important to look out for what's happening and figure out what's going on so that the most accurate diagnosis can be obtained. So I'm just going to go through this quickly, but the assessment process. So if someone comes in to me and says, I feel like I'm easily distracted. As a neuropsychologist, my brain goes to multiple questions. Is it difficulty concentrating? Is there a high attention to detail? And could it be autism? Or are they just really worried about their performance and fearful about any number of things and therefore having a hard time concentrating? Or someone else might say, my kid often interrupts others. The neuropsychologist's brain in me says, is it impulse control? Are they having difficulty with social cues, which is autism? Or are they overwhelmed by their emotions, which is anxiety? Someone else might say, my kid doesn't listen when I tell him or her to do something. Is it ADHD, like difficulty concentrating? Or are they having difficulty processing sensory information that's coming into them and figuring out what to filter through? Or are they ruminating about any number of fears and therefore not paying attention because they're living in their head in that moment? Or someone else may come in and say, you know what, my kid is overly focused when playing and won't stop when what they're doing when I tell them we have to go to school or we're going to hang out with grandma. And this always leads to a tantrum or a breakdown. And my question, in my mind, I'm thinking, is this impulse control related to ADHD? Is it fixated concentration where someone's overly interested in a particular topic that you would see in autism? Or are they having obsessive worries about not finishing what they're doing, and that leads to fear about leaving things unfinished. So it could be any number of things. And the reason why I gave those examples is there subtle differences can lead to very different answers. So when you're working with a neuropsychologist, is really what we do is we recognize that there's a clear criteria for every diagnosis, but there's also a lot of overlap. And we work really carefully to distinguish between the subtle signs based on someone's history, their behaviors in school versus at home, or work versus at home, their responses to stress, performance on the tests that they do in the office with us, as well as the quality of their responses. So it's not just a score, but it's how we interpret that score based on all the history information that we have. Why is a neuropsychological assessment important? Because it's unclear why someone or someone's child may be having frequent or long meltdowns, or sensory issues, difficulty making friends, staying organized, why they may not be as independent as their other kids and need a lot of reminders to get their work done, or you sitting right next to them for them to actually finish a project that should have taken 20 minutes. It ends up taking an hour, with having them try to do it on their own, and then you end up having to sit with them and do it with them. There's also struggles, or you may want to have a neuropsychological assessment because the struggles are getting in the way of their accomplishments. They're smart, they're intelligent, they have a lot of capabilities, but they're underperforming. Their grades are bad, they're not turning in their assignments. Why? And the neuropsychological assessment can answer that. Is it because they're forgetful? Is it because they're anxious about the teacher grading their work? And so therapy, and also a lot of times people will come to us because therapy has been minimally successful. They've tried therapy, whether it's parent management therapy or even medication, and it just hasn't really been that helpful. And also sometimes people come to us because they have concerns about medication. You don't want to give a medication if you have the wrong diagnosis. And it'll be minimally effective, obviously, if they don't have that most accurate diagnosis. So a really thorough deep dive will really be helpful. And the outcome is that you'll get a lot of treatment options. We talk about not just psychotherapy as a blanket statement, but the types of psychotherapy that could be really important. Like, for example, if a child has anxiety, we would recommend SPACE as opposed to just parent management training, because SPACE works with parents to identify the accommodations that they're doing to further support the anxiety that the child is expressing. So not just psychotherapy as a blanket statement or parent training as a blanket statement, but the type of recommendation we make is really specific based on the diagnosis, or executive functioning coaching or medications. You want to have the most accurate diagnosis because, for example, if you have someone with ADHD or autism, but they've been initially misdiagnosed with ADHD and you're giving them medication, it's very well proven that individuals who actually have autism and ADHD are less likely to have a robust response to medication. So understanding why medication may not be working as well comes from an accurate diagnosis. And lastly, school accommodations are so important. All three diagnoses can come with specific accommodations that the school can provide. And so just quickly here, neuropsychologicals are very comprehensive. A lot of times when people come to us, they've already worked with a psychiatrist or another medical professional, but it was a quick evaluation. It wasn't thorough. They didn't ask a lot of questions. They had them take a questionnaire. And the reality is with a neuropsych, you do a very long and intense deep dive so that you can come to the most accurate conclusions about why we're seeing behaviors at home, school, or work, or a difference between those two settings or three settings. And with Neuropsyc assessments, we look at IQ testing, academic skills, memory, executive functioning, which includes attention, impulsivity, adjusting how they're able to adjust to change, social skills, as well as emotional functioning, like is there anxiety or depression or low self-esteem, and how do they cope? So we really do a great job of gathering data from a variety of sources. It's important to us to not just get if you're having your child assessed, for us to also get information from teachers and parents and the child. If you're an adult coming in, we'd want to talk to a spouse or a therapist that one is working with to really get as much varied information so that we come to the right conclusion, not just any conclusion. um, and the reality in closing is that a neuropsych assessment is just not a piece of paper that you're going to get with your history, a diagnosis, and a list of recommendations. But the reality is, when you get a neuropsychological assessment and an accurate diagnosis, you don't just figure out what your strengths are, but you better understand what your challenges are. And it helps to explain why you or your children have had so many difficulties in the past that couldn't be overcome just by willpower alone. And a lot of people find it very empowering, and get a lot of self-confidence from having a diagnosis, because they know that it's not them that's the problem, it's the diagnosis that's creating a problem for them and preventing them from showing who the best parts of themselves. With an accurate diagnosis, you can create an accurate plan of action that can help you alleviate some of the behaviors that are hard for you, whether that's medication or therapy or training. And it'll allow you to be an advocate for yourself at school or at work, to say, this is what I need in order to do my best and to thrive. And lastly, those adjustments that are made in self-confidence and through therapy and medication and just having a diagnosis can really be important in changing the expectations from others. And as a result of that, we see a lot less conflict within families, at school, and at work, because people understand it's just not a factor of someone's willpower or them being resistant. They actually have a clear and accurate diagnosis that's causing a lot of disruptive behaviors. And we've had a lot of parents say, just the fact that my child was given a diagnosis and we talked to them about it, we noticed that there was just an improvement in their maturity. And I've heard this a lot from parents as well as educators. Sometimes just knowing what it is that's been a barrier makes a huge difference in maturity and confidence. So thank you so much for your time. And please, I'm open to any questions.
Thank you so much, Natasha. I love listening to you talk. You did such a great job.
Okay.
We definitely have some questions here, plus lots of questions that people asked us as they were registering. So if anyone does have questions that were sparked by the presentation, please feel free to add them to our Q&A box and we will try and work through them. So, one of the questions that kept coming up, especially in some of these questions that people just wrote in and also the registration questions, was about why get a diagnosis anyway? And I feel like you did a good job at the end there talking about what the benefits of a diagnosis can be. Are there any downsides to getting a diagnosis? A lot of times parents come in and they are worried that we're going to slap a label on their kid, and they're worried that the kid will use it as a crutch. I hear that language quite a lot. As a crutch to really never try to overcome some of the challenges that they're experiencing because, well, I have ADHD and therefore I'll never be able to do better at this. So what do you say to those parents?
No, I think that's a great question. I think it's a valid concern. I will say, having worked with parents after the fact, after their child has had this diagnosis and it's been shared with the school, the overwhelming majority of the time, it helps as opposed to hurts them. It's not something that kids tend to use as a crutch, even though they can. I'm not taking it away from that. But the reality is, one thing that's often overlooked is that when a kid has ADHD or autism or anxiety, they tend to blame themselves for it. And the more you can understand that I have something that's not just in me, but it's just a part of me, it's not all of me, that can really make a huge difference in terms of their self-confidence and therefore their motivation and their abilities sometimes to control their behaviors a little bit more, but also have the confidence to speak up for what they need. I have dyslexia, and therefore it's harder for me to do X, Y, and Z. So can you help me with this? They're more likely to ask for help as opposed to trying to figure it out on their own and then crashing.
Yeah, fair enough. Another question that came up quite a lot is about not only teasing apart the different diagnoses, but also how to respond when diagnoses do overlap. And so one question is, if you have a child who, say, has already been diagnosed with generalized anxiety disorder and ADHD, but now she's suspecting autism as well, does it matter to get that third diagnosis? Does treatment substantially change when you have an interaction among diagnoses?
I'm really enjoying these questions. So yes, I will say yes, it does matter because the reality is if your child has anxiety and ADHD, but it's because of in part because of them having autism, it can very clearly change the treatment protocol. The approach is very different. The medications can be slightly different. And the understanding of others around them is very different also. So it's really important to get a clear diagnosis so you figure out what the best approach is, as opposed to kind of picking things piecemeal and seeing what lands. You can be a little bit more focused on that approach, and it'll
Yeah,
more likely to work sooner.
yeah.
So
And I will also say that that while getting the diagnosis is important for communicating all the information that you just talked about and communicating to other individuals, it also isn't enough. So diagnoses can be very wide buckets. And so just like Natasha said, being able to see how the different things are interacting is going to be very unique from person to person too. So whenever you are diagnosing somebody, you're also giving a lot of, or at least we do that in our evaluations, our diagnostic process, is giving a lot of very specific and unique information about this particular person and how it is playing out for this person and how it is interacting with these other sorts of issues in this person. And that's, I think, really important too for really tackling setting up the best way to tackle these problems for this particular person. And this actually kind of dovetails nicely with another question we had, which is, what are some of the interactions that you tend to see with, say, ADHD and anxiety? And how does that look a little bit different from, say, just either ADHD or anxiety on its own?
it can look similar, but usually the symptoms are more severe. So you tend to see a lot of anxiety, but also difficulty focusing. It can lead to difficulty in showing empathy when they're around their peers. So they want to engage, but they feel overwhelmed when other people are expressing emotions because they can't focus on those emotions. So they end up withdrawing, which can impact relationships. So usually it just becomes more of an intense presentation, or more severe, as opposed to if it's one or the other, it usually isn't as severe.
Mhm. I feel like I also tend to see more avoidance when we see someone with both ADHD and anxiety. I think avoidance is one of the things that is um, that makes an ADHD diagnosis or an anxiety diagnosis particularly impairing in the real world. Is that when you have someone who is more likely to avoid the things that are difficult for them, and many of us do that, but there's a spectrum of who is more likely to do that, take this avoidance as a coping style, that leads to more impairment in relationships and work and school and things like that. And I feel like I tend to see more of that avoidance when you have both anxiety and ADHD at the same time. What do you think?
I definitely agree with that 100%. Yeah.
Yeah, sweet. So, you talked a couple of times during the presentation about misdiagnosis, which definitely comes up sometimes. And so one person asked, are neuropsych results so subjective that one can be misdiagnosed, or are the results always clear and concrete? So I'm gonna let you take that one.
Yes, you can have a misdiagnosis, but it's less likely, far less likely with someone who has a deeper dive into what's happening with the history and getting a lot of collateral information and looking at objective testing. And I can speak very highly of Small Brooklyn um, for a number of reasons, but in part because we all look at the reports together and we all look at the information as a collective. So you're not just having one neuropsychologist make one assessment, you're having a group of neuropsychologists make a conclusion, and that leads to even more likelihood of accuracy, which I also think is pretty high with us individually, but even more so as a collective.
Yeah. I also think that it's there's definitely an art and a science to it. I would say that the neuropsych process is definitely somewhere between the totally subjective and the clear and concrete, because we don't have blood tests, for example, to tell us, oh, this person has ADHD and this person has autism. And anytime that you are approaching diagnosis, it's really important to look at the whole, almost a three-dimensional constellation of strengths and weaknesses. And how is that particular pattern indicative of one diagnosis versus another? And then, just like Natasha said, we are going to kind of talk it to death and make sure that we have a consensus about what that means. But we are looking at that entire constellation in order to get to that place, which really reduces the likelihood of a misdiagnosis, as compared to another practitioner who may or may not be a neuropsychologist. For example, some pediatricians might choose to diagnose ADHD based on a behavior checklist. I think Natasha talked about this a little bit earlier, that a lot of behaviors that are associated with ADHD, if you are checking them off on a checklist, it's going to be like, oh, he has ADHD. But if you're not looking at the rest of that constellation, then you might end up with a misdiagnosis because you're missing the fact that actually this is anxiety, or this is a learning disorder, or something that is leading to problems with concentration.
Very true. Very true.
How about, we had a lot of questions about how these diagnoses show up in early childhood, toddlerhood, early elementary school. A lot of questions about when is it too early to diagnose, and can you really pick up on these diagnoses at that early age? And so what are some of the ways, you described a lot about how the three A's look in children and adults. Is there anything different about how they're going to present in really young kids?
It can be. So with autism, you are more likely to see language delays or no language with kids who are 18 months to 2 years or beyond. With anxiety, you may see selective mutism. You may see a child who doesn't talk in social situations, whether that's with friends or with families. And in ADHD, you tend to see a little bit more of the hyperactivity as opposed to the inattentiveness, because they have fewer things that they need to focus on. So with really young kids, ADHD, hyperactivity is usually the first thing that pops out. Autism, delays in language, eye contact, and engagement and interest in other people. And then with anxiety, it can be selective mutism.
Mhm. And one of the things I think tends to show up in all three with the toddlers is the tantrums. The tantrums are, they are big and they are loud and they are explosive. And unfortunately, they can look very similar from condition to condition. So a lot of times, for example, anxiety is something that can be harder to pick up on in a toddler because they're having a giant tantrum that might look like, say, defiance or um, sensory overload. And it might be sensory overload in anxiety, but it can just be extreme fear. So in all three of these diagnoses, just in terms of what do they look like, a lot of times you're seeing meltdowns too. So I think it is harder to tell sometimes in those early ages, and especially because so many of these behaviors are totally normative too. They're very developmentally appropriate for a toddler to have meltdowns, to have lots of energy and not be able to control it, to have trouble sitting still, or to get so involved in something that they get upset when they are pulled away from it. And so it's really important to um, not only distinguish between the three A's, but also to even tell whether it is outside of what you would expect at that developmental stage anyway. So in those situations, I think some practitioners, they are shy about diagnosing something at those ages because of those difficulties. But it does happen, that you can make a diagnosis if you are seeing behavior above and beyond what you might expect, and if it is particularly impairing, and that's really the key there. So talking to somebody like one of us, or starting with your pediatrician, or finding a psychologist in a practice that can give you some advice on whether this is to be expected or not would be a great first step. What about the pandemic? How do we tell Zoom fatigue and remote learning and learning gap stuff? How do we tell that apart from true psychological diagnoses?
Looking at history is really important. One thing that we've noticed with a lot of the kids coming in, even though it's very clear that there are significant reactions to being doing remote schooling and not seeing their friends, there were always signs beforehand. And there were signs at home and there were signs at school, but they were just much more exacerbated by the fact that they're not in school and they're not seeing their friends and they're cooped up and they can't play. So yes, we do tease that out quite a bit. Sometimes it may just be an adjustment disorder, but other times it can be ADHD or the burdening of another mental disorder. So
Mhm. And trauma. I think
yeah,
we've all experienced quite a trauma this year.
very true.
So yeah, again, it's just helpful to be able to talk this through with somebody who has some perspective on it.
Mm.
Um, what about sleep? How does sleep interact with these things and muddy the waters? So if you have somebody who's really not getting enough sleep, can that produce some of these issues?
Yes, it definitely, I don't know, I wouldn't say it produces autism, anxiety, or ADHD, but it does make it worse. And so, we definitely have a good handful of kids who come in, and adults with sleep issues, but the reality is there are other things happening. And the sleep issues are exacerbating the difficulties they're having with concentration and memory and any number of things. So I think it's a lot of times we will recommend a sleep study, but a lot of times we have people who've come in who have already done a sleep study, have already have a sleep diagnosis, but it's a lot more than just a sleep issue.
And this talk is obviously focused on diagnostic issues and being able to tell the signs and symptoms of these things, but a lot of people are asking, okay, now what do I do about it? So are there just kind of basic treatment strategies that you tend to recommend for these diagnoses, and how do they differ among them?
Yeah, I think it's really important to listen to what your child's needs are, and have open conversations with them when they're calm. So usually you're not often going to get a lot of great information when they're having their tantrum and an outburst. But if you can talk to them calmly when they're calm, and a little bit removed from the situation, you can a lot of times get a lot of helpful and useful information. And also just kind
Mhm.
of pay attention to what's happening in the environment. Look for patterns that arise. Look to see how they're interacting beforehand, and see if it helps determine when and how severe the outbursts are.
Yeah. How about like clinical treatment? What kinds of things do you tend to recommend for ADHD, autism, anxiety? What's
Good
helpful?
question. Parent management training a lot of times can be helpful because a lot of times parents um, feel stuck and don't know how to intervene, and may sometimes inadvertently be promoting or accommodating a behavior, which further exacerbates the anxiety. So for example, with space, it's a parent training that's really geared towards figuring out what are the accommodations that a parent is making that further supports the anxiety at home and in school. And if you can change what the accommodation is, you can decrease the anxiety. Also for disruptive behaviors, it can be really important to do some type of parent training, whether it's ADHD or anxiety or autism. Um, and executive functioning coaching, we always find that to be very helpful because it really does help develop independence in school and at home. It's not just meant for them being independent in the home environment, and that can be really helpful in terms of getting them to do their schoolwork. You know, washing their hair, things like that. Those independent skills are really, so executive functioning is really helpful by someone who's skilled and does research, I will say.
And someone who isn't you, so you, the parent, are not always the one who's telling them, go do your homework.
Yeah.
Yeah, I totally agree. And we've been finding more and more as a field that parent training can in many ways really be a lot more helpful for building self-regulation skills for whatever reason, whether it's autism, ADHD, anxiety, than working directly with a kid. Because so often those kids get so swamped with a strong emotion that in the moment, they are not always able to remember what Dr. Sam told him in the office, last week when he sat there for just 45 minutes. Versus when parents learn these strategies and they can implement them throughout the week in vivo as meltdowns are starting to happen, can help notice when a kid is starting to lose it, can help point it out to the kids so that they can start taking that step back from their swamping emotions and take that pause to say, okay, I'm going to give myself a little bit of space here. So that the parents are providing that kind of wraparound treatment in ways that the kid is not always developmentally prepared to be able to do for themselves. But then, of course, as they get older, they're better able to take advantage of individual treatment, especially for anxiety and mood sorts of issues too. And then, maybe just a last question since we're already over time here, but at what point do we decide that the normal, you talked in the very beginning of the presentation about how a lot of these traits that are consistent with the 3 A's are also just normal things that we've all experienced. So at what point do those things become a diagnosis or worthy of a diagnosis, worthy of seeking extra treatment, whether it's an evaluation or a consultation or a therapy?
No, that's a great point. So severity and prevalence. How frequently does this occur for you or your child? How is it getting in the way and creating a barrier to reaching your capabilities and showing your strengths? Is it occurring across different environments, school, work, home? And I think a lot of times we have a good sense for ourselves or for our kids that there's just, it's more than the norm. And so sometimes that's a really good point to say, you know what, let me just not be the one that's diagnosing myself. Let me go into someone who can help me figure out, is this normal? Which sometimes it is the case. Or is it beyond what I would expect, what they would, and I would expect to be normal?
Yeah. And so often we have parents coming in who say, this is something that I've known in my gut has been a problem for a couple of years now, but I keep doubting myself. I keep wondering, this is probably fine, and I'm overblowing this issue. And the reality is that more times more times than not, there is something to that gut. There is that parental intuition or an intuition about yourself, and when you are struggling with something and it feels like it's more than others do. And there's no downside to talking that over with somebody who does this for a living. So the very worst case is you come in and we talk it over and we say, actually, you're doing okay. You're doing reasonably well. And this part might not feel so great. And so here's some things that you can do to help, this particular symptom that you're having, but it is not, indicative of something larger and more impairing. And that's kind of the worst case scenario, that you're fine and you're doing great. But in the best case scenario, you're finding out a lot more about yourself and your child, and being able to tackle some of these issues in a way that makes you feel supported and validated, but also is helping, for that longer term trajectory. Yeah. Hey, thank you so much for joining us. We are, this is the last webinar in our series, so please do feel free to go back and watch our other series. If you go to our website and go to Community Talks, you will see all of those recordings. I will be sending out the recording and the slide for tonight's presentation as soon as I get a chance to do that. And feel free to reach out to us at smallbrooklyn.com if there is anything that we can do to help you. Natasha is there, Natashia at smallbrooklyn.com. I am Mandy, M-A-N-D-I, at smallbrooklyn.com. And we're happy to help if we can. So thanks so much and have a great night.
Have a great night. Nice seeing you all.